Applied Health Sciences in Toronto. To begin, we feel it is important to define the term marginalized population. Marginalization is defined as relegation to an unimportant or powerless position within society. Ginny's homelessness, lack of income, drug abuse, and HIV-positive status, along with the stigma surrounding her situation, make her part of this population and contribute to her overall unfavorable prognosis, which we will discuss.
So the question we've been posed is, what is Ginny's prognosis? And the logic we took in our approach to answering this question is to divide Ginny's multiple issues into three categories: acute health issues, social support issues, and finally, chronic disease issues. For Ginny's acute health issues, we have further prioritized them in the order of severity as being pneumonia, diarrhea, and feet and gait problems. These three acute health issues are very treatable and could be made into having a favorable diagnosis.
The first acute issues to look at are pneumonia and diarrhea, and we assume Ginny already has a physician since she's already taken medication prescribed for patients with HIV/AIDS. Addressing these two issues involves many healthcare disciplines working seamlessly in the patient-centered care team for Ginny, such as radiological technologists for the chest and abdomen x-rays, nuclear medicine technologists for her gallium scans, and of course radiologists to read her medical scans. Moreover, medical laboratory technologists are involved with her blood work, and if required, a respiratory therapist is involved to induce the sputum for the sputum analysis. A pharmacist can also help with Ginny to manage her many medications. Now, in order to address her feet pain, perhaps Ginny would benefit from either consulting a physiotherapist, occupational therapist, or a chiropodist. And furthermore, complementary and alternative medicine therapies as acupuncture and chiropractic are associated with addressing many of the mental, physical, and emotional challenges that HIV-positive patients face.
So in order to improve the prognosis of Ginny's acute health issues, we suggest that the various professionals we have enumerated be found in a centralized health clinic location to reduce the burden of multiple appointments and treatment at multiple locations.
So next, we'd like to focus on Ginny's social support. At the moment, we believe this is unfavorable, but with proper assistance and guidance, this can become favorable, improving her quality of life. As we've said previously, Ginny is part of the marginalized population. The main difficulty regarding marginalized populations is the lack of resources available and the difficulty in navigating them. Primarily, Ginny needs shelter and proper nutrition. To obtain these, we've found several resources in Saskatoon which she can use, and these include the Salvation Army Community Service to provide a stable shelter, the nutritionists and nutrition programming at AIDS Saskatoon, the Saskatoon Friendship Inn and Saskatoon Food Bank and Learning Center for nutrition supplies, and a social worker to navigate the system, which she can obtain through the Ministry of Social Services, which she can get assistance from with the AIDS Saskatoon and Salvation Army.
In terms of Ginny's strong social support systems, this is where we bring her sister and her non-denominational spiritual advisor to not only address her emotional and spiritual needs, but also help her navigate through the social, medical, housing, and employment resources. In terms of her financial support, once she has a stable place to live, we can see AIDS Saskatoon to establish a welfare for Ginny, and also utilize Ginny's past experiences as an investment banker to help her manage her own finances.
Although the prognosis for her chronic illness, such as her HIV-positive status and her heroin addiction, are not as favorable and pose a challenge, we feel that they are manageable. The Saskatoon Health Region offers a methadone-assisted recovery program that dispenses methadone daily and offers counseling. As Ginny expressed interest in going to a methadone clinic, providing her with this information would empower her to take control and hopefully begin overcoming her addiction to heroin.
In Canada today, HIV/AIDS is a fairly manageable disease. With treatment, Ginny's quality of life can be improved and extended by 15 to 20 years. But this depends mainly on her compliance to her medication. Her investment broker personality can be harnessed by professionals working with her and used to balance the power, improve relationship, and empower her to self-manage her disease. AIDS Saskatoon's Positive Support Group and 601 Outreach Center offer social supports already touched upon, and this blur line of overlapping responsibilities, as mentioned in Romano's report, is what enhances collaborative patient-centered practice.
So as you can see, we're a team of applied healthcare professionals. Although we don't have a physician to authenticate our findings, we believe that due to her lack of social support and her chronic conditions, prognosis at the moment is unfavorable, but with the proper resources, it can become favorable, and she can have an improved quality of life.
Thank you.
Thank you.